Hi, my name's Alexa. I'm going to be your student nurse today. Can I have you confirm your first and last name and your date of birth? Ruben J. Matias, 3/2/1972. Okay, awesome. And do you have any allergies to anything like betadine or latex before we begin? No? Okay. So the doctor ordered me to come and insert a catheter just to track your output of urine, if that's okay. I came to provide pericare earlier for that same exact reason. I'm gonna go ahead and put this down. Before we begin, I'm gonna go ahead and clean my workspace with wipes. And the manufacturer recommends 2 minutes, so what we're going to do is to thoroughly clean. Making sure everything's clean. Okay. So I'm going to go ahead and pull your blanket down, making sure I maintain the patient's privacy as much as possible. If that is okay with you, I'm going to go ahead and set my biohazard bag close to your legs here, just so it's easier access. And I'm also going to go ahead and put on another pair of gloves. Just to go ahead and set this blue pad underneath my patient. I'm going to go ahead and lift your gown and position your legs like this. So I'm going to go ahead and bend both of your knees. Let me know if you are in any pain when I do that. Okay, I'm going to go ahead and place my blue pad underneath my patient. I'm going to go ahead and have you lift your hips for me. Perfect. Okay. Now I can go ahead and move my items onto my clean workspace. I'm going to go ahead and I had to scratch my face. Go ahead and put hand hygiene again and begin to open this. Go ahead and remove this. And dispose of this properly. I'm also going to open away from me. And I'm going to go ahead and put on some sterile gloves. I'm going to go ahead and dispose of this on the floor. I'm going to go ahead and position my items the way I would like them. And bring my work area a little bit towards me as well. I'm going to go ahead and open this, making sure that I place the shiny part down. that's it. And place it underneath my patient, making sure I avoid any contamination. And here are my other sterile gloves. Do no longer need. As well as put this around my patient. Okay. I'm going to go ahead and set out my items. I don't have any use for this, so I'm going to put it aside. My betadine. I'm going to go ahead and open my catheter, making sure that it doesn't touch anything outside. And since the box is sterile, I'm going to go ahead and place it back into the box. I'm also going to take my water, note how much water is in there, and I'm going to connect it to my catheter. I'm going to go ahead and open my lube and just place it here, and I'm going to set my catheter in the jelly while I prep my patient. And also open my betadine. Making sure that all the cotton salts are well saturated. And I'm going to go ahead and place my left hand on my patient, and this means that my left hand is contaminated. So I'm going to grab my cotton swab and start away from me first. So I'm going to clean this side of the meatus first. Just one swipe from front to back. And then I'm going to go ahead and do the other side. And then just in the middle. Okay. Now I'm going to go ahead and make sure to grab my catheter and move my box over. Okay, Ms. Matias, I'm going to go ahead and insert the catheter. You might feel a little bit of pressure, but that is okay. I'm going to go ahead and insert. I should insert 3 to 4 inches, or until I see urine expelling out, or until I feel resistance. So I'm going to go ahead and leave it there, and I'm going to go ahead and push in my water slowly. Okay. Now that all my water is in, I'm going to go ahead and disconnect my syringe and place it over here. And I'm also going to check for any placement until I feel resistance, and I feel resistance. So now I can go ahead and, with my clean hand, I'm going to go ahead and remove my continents from inside my bag. Now I can go ahead and remove my sterile gloves. Perform hand hygiene. And apply clean gloves. Go ahead and grip this, maintaining sterile field, as well as removing any of the items underneath my patient. And throwing these in the biohazard. Okay, Mrs. Matias, I can go ahead and straighten your legs out and provide privacy. I'm also going to go ahead and make sure there's a little bit of leeway so it won't tug on her if she moves or anything like that. I'm going to go ahead and apply some tape for it not to move or tug or pull when she does move her legs. Okay, and then I'm going to go ahead and place her bag where it's not touching the floor or kinked or tugging at all on my patient, making sure that my patient is at a comfortable position. I would dispose of the biohazard as in the correct disposal. I'm going to go ahead and cover you up, Miss Matias. How are you doing? Are you okay? Good. I'm going to go ahead and raise the rail and lower the bed down a little bit. With the bed. And I'm going to go ahead and place your collet next to you, so if you need anything or are in any pain, you can let me know. And then I would clean up my materials and dispose of them where they should go, and that is the end of my Foley catheter video.